Hello everyone, I am a Kenyan citizen. I was a sex worker for many years and have lived with HIV and AIDS for the last 15 years with undetectable viral load. This means I feel healthy as you, as long as I take my drugs.
For far too long, sex workers have faced stigma, discrimination, and limited access to essential health services.
There's a lot of stigma associated with sex work, with key populations, with MSMs and so on and so forth. Our focus is to ensure that we provide friendly services, accessible and friendly services to these populations.
My name is Joyce Adhiambo, and I'm a sex worker who is living with HIV for the last 20 years, and I'm able to achieve undetectable viral load. And I'm also a community champion for HIV, TB, and malaria, and I'm also a community researcher. I work with Partners for Health and Development in Africa. Basically what I do is I do advocacy in terms of HIV prevention for the key populations and the most affected groups.
Key populations are vulnerable populations who are at high risk of HIV acquisition. Yeah. Mainly we are looking at female sex workers, male sex workers, transgenders, people who inject drugs. And that the reason why key populations, the HIV prevalence among this population is quite high.
This is why Partners for Health and Development in Africa came up with the Sex Workers Outreach Program, a health agency that promotes the safety, the well-being, and the health of sex workers in Kenya while affirming their occupation.
So, SWAP is a community-friendly organization that brings all sex workers together and offers free healthcare services to all. Hatufai kwenda kutangaza status ya watu kwa nje, hatufai kuongea kuhusu health condition ya mtu yoyote. I joined the program in 2010 as a peer educator.
Okay.
During those days, I was not the way you can see me.
Yeah.
It is because of the capacity building that I've gotten from SWAP and PhDA. I used to be a very drunkard woman, and I didn't know I have this potential to reach out to my fellow sex workers. So I was identified from the hotspots with one of the prevention officers, and then I was taken for the trainings as a peer educator, and then I became an outreach worker, and then later on I became a community champion for HIV.
And the government has a curriculum of training the peer educators. They are called peer educators. We have an official curriculum through NASCOP, which empowers the peer educator to be able to deliver some services, to deliver information, and to be the contact person between the peers here, her fellow peers, and the HIV prevention programs.
In 2020, during the peak of COVID and the closure of hotspots, the Sex Workers Outreach Program created the Safe Clinic Network app.
Yes, so this is a digital app that you can get from the Play Store. You can download it from the Play Store, and you're now able to, if you want to get services from the clinic, you just book an appointment from the Safe Clinic Network app. You can also request for commodities. In case you are violated or you're facing violence, you can also go to the GBV SOS, and then you just make a phone call, and then you get services.
Our services are networked across Nairobi, wherever we are. Our clients can access health services, and their data is available across our services. I mean, confidentially and accessible to who needs to, but in all our facilities. So just like your insurance, you can go to any hospital and get services, and your records are retrieved. We also leverage on social media handles to pass our information. There is a lot of activity in the digital space, in the social media forums. A lot is going on. So more recently, we are focusing on how do we get have a wider reach as opposed to the hotspot, which is very physical? How do we leverage on the virtual spaces to actually deliver a message of what services we are giving? Yeah.
Thanks to Partners for Health and Development in Africa, the journey towards achieving universal health coverage is gaining momentum. With each step, we move closer to a healthier and a more inclusive society for all. In our next episode, we get to understand the importance of digital health technologies and why more people should adopt them into their daily use.
Love Matters. Open, honest, sex-friendly.